Okay, my mom officially did tweet us, and 5 minutes ago, so at 9:50, so she got in before the show was over. She said, good information, so that's good to know, although she wouldn't want me to publicly call her a senior, I don't think. She's going to be a grandmother soon for the first time.
Older American is the new term.
Older American, I like that. What, I cut you off, Dr. Kimmy. Anything?
I'm sorry, I was pretty much done.
Oh, okay, all right, very good. Well, you can be excused. What else did we, you mentioned the jargon, and that's my responsibility. I didn't weed through that well enough, but what else should we have talked about?
I'd like to say something.
Let me see if you got it. If you don't have a mic, I'm going to hand you one of these. There you go.
One of the things that Dr. King said that I'd like to touch on is you can use nonprofit.
Here, try this one. That one seems to be going in and out. I don't know.
You can use nonprofit or profit organizations to figure out what your choices are and for someone to guide you. And what we were discussing is you might be comfortable with going on the internet and doing it on your own. You may be comfortable with the woman, the older woman at the senior center with a microphone, or you can use an agent. Or you can just call Medicare.gov or 1-800-Medicare. What's important is do what you're comfortable with. There is no difference in the price that you're going to pay, regardless of whichever option those are. And that's one thing that we kind of failed to say in all of our conversations. They're not spending any more for an agent or any less for an agent. They're not spending any more if they do the telephone call and roll over the phone. So
individuals might pay different amounts, but that individual person will not pay a different amount for
because they're using a different type
right.
of way of enrolling in a plan. So that's important.
Anyone else? Yeah. Do you have a mic? Let me get you the mic.
The question, did we not talk about something that may be important related to this? We really didn't talk about it from a healthcare reform perspective. What happens to the providers and their interaction with those Medicare patients, the hospitals, the nursing homes, the physicians? Because there is a massive culture change that's required for these providers to be able to offer the appropriate service and measure the quality and then make that information transparent to those, both the individual patient as well as their family members who have to have that information to really make decisions. The other piece that we really didn't talk about is the system has changed, and all of us, senior, not senior, have to take more responsibility on our own health. We can't just let it happen. There are financial incentives and financial penalties that if we don't take care of ourselves and participate in our own care and care plan, then we will become more financially at risk.
Is it just me, or is this a lot to handle and a lot to take care of? I mean, when you're working at your job, I guess that's back to job lock. That's why people don't want to leave when they have something set up. But I mean, the American way is to have as a friend of mine says it, a hassle-free life. That's like our goal, right? There's no such thing, I guess. You started to say so. That wasn't a question, apparently. That was just, I just had to, no one's asked me any questions tonight. I just had to say something.
Some of the things that are interesting, building on the point that was just made, there are remarkable systems change taking place as a result of Affordable Care Act. They're moving from a volume-based system of the more people you get in, the more billable hours, the better off you are, to a quality-based system is remarkably different. And so as a result of that, people know that to become a better quality organization, they have to do business differently. Like we've already brought up, for-profit and non-profit companies speaking to each other, physicians talking to other physicians, physicians talking to nurses. And so this idea of integration is going to be key. And how do these organizations do a better job at caring for people both in their communities as well as the more traditional clinical institutions?
Tori, something we talked about last week, you've got your mic on, so you're good, but for those that weren't with us last week, LGBT seniors face a specific set of issues. Can you just kind of address that for us?
Right, LGBT seniors, especially in the aging process, some of the fears and anxieties they may have are not like, how am I going to take care of myself, but who is going to take care of me? Will I need to go into a nursing home or assisted living, and will I be accepted and cared for there without being discriminated against or mistreated? Also, many of the LGBT older adults are aging alone. They don't have any children, they don't have any family members that are close by to take care of them like the average heterosexual person may have. So they have that fear and the limited income. Like I said last week, I believe I said last week, was that the average income for an LGBT senior is between $16,000 and $21,000 a year. So coupled with the higher cost of medication and the higher cost of living overall, it presents unique challenges for the LGBT senior.
Again, stressful. Okay, I'm sorry, I cut someone off, I'm sorry. Did I not?
I was just going to go back and add in.
Oh, hang on, let's get your mic back.
Sorry.
That's okay.
You know, to add on what you were talking about in terms of physicians have to talk differently to nurses or, et cetera. But the big thing we really have to understand is that we are now having those providers, hospitals, physicians, talking to people and providers outside of their system to coordinate care. So it's not under the same employment. It's not under the same ownership structure. They're going to have to reach out to truly coordinate the care to be able to learn how to talk to each other without being able to potentially share in that financial component.
So, okay, go ahead, Doctor.
Yeah, and I think that this point that just came up is a really important one. I think there are three things that will cause the Affordable Care Act to fail. One will be that the cost. I mean, if we can't do something about the cost, well, the charges for care, we're not going to be able to make this work. It's just simply going to get too expensive. The second one is what has been referred to here, and that is providers, and how we get enough providers organized in a way that they can provide efficient quality care. And that means new relationships. It means new respect among some of the provider groups who have not necessarily respected each other over the 50 years that I've been around. So those are two important. The third one's health literacy, and we've talked about that a lot here. We've talked about it in terms of literacy about insurance and literacy about medical, but it's a broader concept. And this country is health illiterate. And if we don't do something about that, the Affordable Care Act will fail, because so much of it going forward is dependent on successful preventive programs. It's dependent on people making intelligent decisions about their coverage and intelligent decisions about when to use medical care. So that's three things that could really put this on the rocks.
Can I ask the group one more time, just kind of what I asked on the Hangout, which was, what should I tell my mom? What's the one piece of advice we should tell our parents? I mean, I'll go back to you, Tori, because I kind of left you hanging there on that last bit. But what's your takeaway?
My takeaway was that not just for LGBT seniors, but for seniors in general, I think the more information they have about what is out there available for them, the better. I mean, there are many people that don't even know about some of the programs such as Silver Sneakers. My father, who's 73 years old, he had no idea about Silver Sneakers. He was paying for a gym membership until his gerontologist son calls him and says, "You have Medicare. Why are you paying for this gym membership?
Yeah.
Call up. You're able to get Silver Sneakers." So I think our seniors just need to be informed about what's available to them.
Education, okay.
And I would also add,
Oh, here, hang on. Thank you.
find a primary care doctor you trust and you can talk to and you have a good relationship with. Part of this building better systems of care is that Medicare is going to pay primary care doctors more and is paying primary care doctors more because we've underpaid them in the past. We're making them the center of all of these delivery system reforms. And that's really the place where communication is important. You learn health literacy. You begin learning how to take care of yourself. So find a doctor you trust and make sure that doctor is in your Medicare plan.
Last word, yeah. I
The
think
only argument I have with that is find a provider you trust. It may
Right,
be a primary care nurse.
yes,
it can
you're
be a lot of other
absolutely
things
right,
other than a
Dr.
physician.
Or
Yeah,
even a
it-
pharmacist.
Right.
Or a pharmacist.
Very, very
Absolutely,
accessible.
part of the team.
Very good. Okay, well, I think we have to leave it there because we're going to run out of time online as well. So thank you all for being here. Good information says at Kidaloo. That's my mom. All right. Thanks a lot. Stay tuned.